Welcome to Conversations with Melissa, part of RenaFi's Experts and Influencer series. RenaFi provides practical, research-based advice, courses, and peer support, and focuses on the underlying drivers of our ADHD behavior. Through courses like budgeting for the ADHDer, home organizing for the ADHD lifestyle, and of course, our ADHD book club, to name just a few, we provide a holistic program that serves to help you thrive with ADHD, not in spite of it. Follow our YouTube channel for ADHD resources and information, and visit us at renafi.com to learn what we have to offer. Okie doke. Thank you so much, RenaFi. All right, and then thank you so much to our guests here, Dr. Bill Dodson and Beth Bardeen. So today we're going to do RSD from two perspectives. We have Dr. William Dodson, the clinician, what RSD looks like from the outside in. Dr. Dodson is a board-certified adult psychiatrist who does not have ADHD. He has worked with his adult ADHD patients for the last 25 years to understand and document rejection sensitivity dysphoria. Dr. Dodson has been on the forefront of diagnostic and treatment reform for ADHD and rejection sensitivity dysphoria. He is now retired from clinical practice and resides in Colorado. Beth Bardeen, the RSD survivor, what RSD feels like from the inside out. Beth is an adult diagnosed with ADHD after a 30-year career in the Seattle tech industry, specializing in marketing and organizational behavior. Now Beth researches rejection sensitivity dysphoria and is an advocate for the newly diagnosed, with a focus on explaining the internal experience of RSD. She lives in Seattle and is the founder of the Seattle chapter of CHAD. All right, thank you both for being here. And
Melissa, thank you.
I'm just going to step out of the way. I'm going to take the focus off me and let you have at it and interrupt you every so often.
Sure. And thank you, Rick and RenaFi too. This is, we love this opportunity. Really appreciate it.
We have a couple of questions that have to do with the comparison things. But
okay, we can go back and do this now. Off we're here.
So, not exactly on the beaten path. How does RSD event for ADHD differ from an autistic meltdown or shutdown?
I don't know. I have no idea. I can't answer the question.
Okay.
Good, great question.
Yeah.
I hope I'm alive to do the research to find out.
Yeah.
But I
have lived experience with that, in that I have the same answer. I don't know, but my lived experience is that they look a lot alike. They really do.
You also have to remember that 40% of people with autism will also carry a diagnosis of ADHD.
Yeah,
so in that particular case, you don't know what you're looking at.
So much crossover. Yeah. Is rejection a synonym for invalidation?
Sure. Yeah. If you really, really want to hurt somebody's feeling, invalidate their worth, their meaning to you, the validity of their emotions. I mean, that's kind of a double whammy. You're having an emotional form, and somebody invalidates you and tells you to suck it up. Yeah, that invalidation is a good synonym.
It's like the most basic form of rejection of yourself, right? Of what's inside. Huh.
Is RSD also part of CPTSD?
Complex no, that's one of the things I was trying to put in there, that people with complex post-traumatic stress disorder, they get that in a totally different way. It comes from thousands of harmful, toxic experiences where the person internalizes that, they make it a part of themselves, they have a physiological response. And so it comes from a different place. It feels the same. It feels exactly the same, but it also doesn't respond to any sort of medication.
Is
PTSD
there
is
a,
extremely hard to treat. Takes years.
it's just amazing how much distinction you have around this. I wanted to read you a little feedback from the chat. This is so vindicating because it really has been a long time since I caught a break. So that's some feedback from the chat. And then this is still another nuanced question about the difference between ADHD's RSD and neurotypical people, you know, losing their stuff and then having a lot of regret.
Again, and ADHD is not just those 18 criteria, which, by the way, really suck. They're terrible criteria. They're trying to get a new set as we speak. But that you have to have 4 other features. It has to be consistent, persistent, pervasive, and impairing. It has to always be there all day long. Consistent since childhood. Persistent, consistent, pervasive. It happens everywhere. Happens school, work, when you're on the beach, whatever. But the most important thing is losing your keys over and over and over and over. Quite impairing. Takes a huge chunk out of your life. It means you can't be efficient anymore in your own life. And you take a real big hickey on your self-esteem. That's one of the things that's very rarely talked about in ADHD and in rejection sensitivity dysphoria is that inability to maintain self-control is very shaming. People feel terrible about themselves. And so I can't think of any patient who told me about their rejection sensitivity dysphoria sooner than the 5th session with me. They had to get to know me before they would ever bring up the subject. Now, of course, I bring it up, but then, for the first 1,000 patients, I had no idea it was there because nobody would tell somebody else about it because of the shame.
Wow.
So
very profound. I saw you talking about trauma. Is RSD is an extreme reaction to a traumatic event? Should we go back to RSD as a learned response?
no, that was exactly the distinction I was trying to draw. If plain old, how about you next time around? I'm just going to say sensitive to rejection, sensitivity to rejection, to switch the order, maybe clearer that way. That is a response to multiple thousands of life experiences. And many people with ADHD love that. And with the thing about the 1,000 additional negative or corrective messages. I don't care who you are, that's going to have an impact on you. So again, people with ADHD are very unlucky. They have to deal with all 3. It helps to know which one you're dealing with now in order to know what to do.
We have questions like, is this ever going to be something that is got a diagnosis that's got a billable code? Is that in the near future? There's questions about, can we have this presentation so we can share it with our therapist to help them better understand?
I signed it off to you. You get to decide on that.
Okay, good. Thank you for that. And then there was a question that looks to me like from a therapist. What distinguishes this from a form of anxiety? And they put GAD, which I didn't see you refer to.
This right there in the middle.
It is.
I
Good.
lumped all anxiety together. I mean, there are 295 named conditions in the DSM. I couldn't fit them all on there. So I put the 5 biggies.
I can make it tinier.
Again, the definition of what anxiety is fear without a cause. Severe fear, anticipatory fear for no reason.
And it's in advance.
Yeah, I mean,
This isn't, I have a
It's
flight and I'm
constant using.
afraid, right? I'm afraid I have a flight,
I'm-
something could happen. This is just anxious
afraid
all
I'm
the
gonna-
time. Okay.
Yeah.
And
RSD, yeah,
and
more
again,
like
it's
an
one
allergic
of
reaction.
God's jokes and bad taste is he makes people afraid of their own lives. And because that's what generalized anxiety and phobias and all that is. If a person goes through life feeling vulnerable, feeling as if they're about to be attacked. It's anxiety disorders are terrible disorders.